saying that says you are what you eat, but most of us don't know what happens in our gastrointestinal system when we are eating foods or how they affect us. So I was at a meeting of the Chicago Network, which is a prestigious organization of a lot of women who have created firsts in the city of Chicago, and I was lucky enough to meet a professor of biochemistry and gastrointestinal, right? So I want to introduce you to her, but I'm going to have her introduce herself, and we have two other guests with us that are going to introduce themselves and tell you what they do, and then we're all going to listen to a bit of her lecture, and it's very, very interesting, and then ask some questions. So first of all, go ahead.
Hi, I'm really glad to be here. My name is Meena Rao, and I'm a professor in the Department of Physiology and Biophysics at the University of Illinois at Chicago.
Hi, Maria, and my passion is lifelong learning, and I've taught, I've been a school administrator, and I enjoy learning from other people.
And you also have a doctorate in education,
Yes, I
right?
have a PhD in education.
And you have a...
PhD in cell and molecular biology.
Okay. And you have a doctorate in naturopathic medicine.
Yes, and specialize in iridology, reflexology, and herbs, and natural approaches to solving health issues.
And that's Dr. Tony Kufis, who joins us often. So first of all, I just want to start with you. I found just the little bit you told us at the dinner party that was very fascinating about your research and what goes on, so I would like you to tell everyone about that.
So again, thank you, Karen, for the opportunity. And what I work on is not something that you normally talk about at a dinner table, but this is not a dinner table, so we can talk about it, right? So my particular research is focused on trying to understand how the body, and specifically how the intestinal tract, deals with salt and water absorption. Now, what many of us don't normally think about is that yes, we are told to drink about 2 liters of fluid a day, but your GI tract, and by GI tract I mean anything from your mouth all the way down to your intestine, the various organs that line the GI tract add another 7 liters of fluid to that a day. So basically your gastrointestinal tract faces 9 liters of fluid a day, and yet you lose only about 0.1 liter or 0.2 liters, 100 to 200 milliliters in the stool. You do lose obviously something through the kidney and so on. So the intestine is a fantastic organ where you have to have copious amounts of water reabsorption, because you have a certain amount of secretion. And why do you need secretion? In addition to your stomach producing acid, because you need to digest your proteins, you have your pancreas producing enzymes because you need to digest the macromolecules, carbohydrates, proteins, and fats that you eat. And you need some kind of fluid to keep the digested material moving down the length of the GI tract. And that digested material is called chyme, spelled C-H-Y-M-E. And in order for the chyme to keep moving, you need fluid secretion. And starting with the mouth, the salivary glands produce a copious amount of fluid, because if you didn't produce saliva, you wouldn't be able to speak. I wouldn't be able to speak right now. And then you go through the stomach, you then meet the pancreatic juices, the food meets the pancreatic juices, it gets mushed up. And then as it moves to the colon, which is your large intestine, the chyme gets thicker and thicker. And eventually the function of the colon is to essentially reabsorb as much water as it can in order to conserve the water, right? So we are, but the movement of water basically follows the movement of salt. And the simplest way to explain that is when you put a raisin into water, what happens? It swells, right? And it swells because the raisin's skin is a semi-permeable membrane. You have sugars inside the raisin. It draws the water into the raisin. Of course, if you leave it there for long enough, eventually the raisin can swell up and burst. But that premise of water following sugar and salt movement is essentially the way water gets transported in and out of the intestine. And we know a lot about how this intestinal fluid secretion and absorption occurs by understanding 2 diseases. And a lot of biology actually, understanding normal physiology is enhanced by understanding what happens when something goes wrong. And the 2 diseases that have contributed to this particular area of biology are cholera at one end and cystic fibrosis at the other end. So cholera is a disease where you lose copious amounts of fluid. A cholera patient can lose 24 liters of fluid a day, and therefore many cholera patients die because of dehydration. On the other hand, cystic fibrosis is a genetic disease where your ability to secrete fluids is greatly impaired. And by understanding the pathology behind these two diseases, we've understood a lot more about salt and water transport. But still, the whole mechanism is still, there are lots of black boxes in it, which keeps us all in business. So that's in a nutshell what I do. And this is why you can't talk about this when you're
Well, see, I'm a nurse, so we used to talk about it at the dinner table with the medical students and the nursing students. We talked about all these things even at dinner,
Right.
so it wasn't a big problem. But now we're talking about the salt. I mean, every cell is basically the same way because it follows the sugar, it follows the salt too,
Right.
and it can cause dehydration. How is all of this affected by people taking diuretics, for instance?
well, so diuretics essentially work in the kidney.
In the
So,
kidney.
so the kidney, in some, as you perhaps remember from nursing school days, the people who study kidney, the nephrologists, like to think of the kidney as a unique organ, and the people who study the GI tract think of the GI tract as a unique organ, and we think that the kidney is just a microscopic GI tract, and they think the reverse, right? But many of the transport processes in the kidney and in the intestine are similar. So for example, diuretics act on a particular segment of the kidney to prevent reabsorption of salt, so that you prevent reabsorption of salt, therefore you prevent reabsorption of water, and therefore you can have diuresis. Okay? So those diuretics can have a side effect also on preventing excess secretion from the small intestine as well, because they act in a different manner in the small intestine.
Well, what's interesting to me is when they give people diuretics, they're often also telling them to drink a lot of water. So it's taking the water out, but you're bringing new water in.
Right.
So how does that work?
So I'm going to turn that question around a little bit and address it from the perspective of cholera, because cholera is that way a very fascinating disease, right? So in cholera, what happens is you have copious amounts of fluid, as I mentioned, fluid secretion and fluid loss. Why do you get that? You get that because the cholera bug produces a toxin, and the toxin goes into your small intestinal cells. And what it does is it does two things. One is it stimulates the cell to secrete a lot of salt, and therefore you're losing a lot of water along with the salt. Okay. The other thing is it also inhibits certain processes that actually reabsorb salt. So if you prevent reabsorption, again, that means you're going to get more fluid hanging around in the lumen of your gut, in the tube of your gut, right? But the
Do you want that? Is that something that you would want happen or not to happen?
no, you don't want it. I
Excess-
mean, you
excess
don't.
fluid.
Therefore, you get excess fluid loss. Therefore, you have diarrhea. So it's like a teeter-totter, right? So there are two processes that occur simultaneously. You can have salt absorption and you can have salt secretion. And normally, in a healthy individual, there is a balance between the two. But in cholera, what happens is you get excess salt secretion and you prevent reabsorption. So the net result is that the fluid remains in the gut, right? So one of the things that about cholera, and this is coming back indirectly answering your diuretic question of why you ask people to drink water, one of the things recommended remedies for cholera, which is counterintuitive, is people would be asked to drink a lot of water, right? But the idea was, why do you want to drink a lot of water when you're losing a lot of water? The age-old remedy for cholera, and if you go to any culture in the world, your grandmothers in any culture of the world will tell you that the remedy for cholera is to use some kind of starch gruel. Okay, so you use either rice gruel, mushed up rice, mushed up taro roots, mushed up raw bananas, et cetera, et cetera. The reason is carbohydrates are made up, or starches are made up of carbohydrates are made up of sugar molecules. Okay? So the cells of the gut, the cells of the intestine, have a specific transport mechanism that take in sugar. Now when you take in sugar, you also draw water in. Fortunately for us and for humanity in general, the cholera toxin does not affect that process. So what you're trying to do in telling patients to drink a salt or sugar, generally they give them what's called oral rehydration therapy, right, which is Lancet described oral rehydration therapy as the medical marvel of the previous century, of the 20th century. And oral rehydration therapy is basically a sort of a formula for grandma's recipe, which is to drink a lot of pasty starch gruel. And the advantage is that the cholera toxin does not affect the mechanism in the cell that reabsorbs sugar. So basically you're trying to dupe the cell, say, okay, you can do what you want to my salt mechanisms, but you leave my sugar mechanisms, and as a consequence of which you're rehydrating the patient. Okay, so when in the case of diuretics, for instance, one of the reasons you ask people to take a lot of water is you actually want to try and reduce the sodium load, right? And because you're trying to reduce the salt load, the more water you give, the salt is going to go to maintain osmolarity.
Now, some thyroid conditions cause an imbalance also
Right.
of sodium. So how does that work? I mean, is that affected by the gut as well as the kidney too?
The thyroid, no, that's more indirectly by the gut, but it's generally a kidney-related effect.
So when it is indirectly by the gut, if they can't control it with the kidney situation, then what would help it with the gut situation?
For the thyroid, I'm not really quite sure. But what would help it with the gut situation is that if you give, I'm trying to think really hard and really fast about the thyroid situation, and I think I can't give you a clear answer for that.
Now, the aspect of the salt, in other words, if people have diarrhea, should they be having more salt? Is that what you're
Well, if
trying to
people
say?
have, it depends on what causes the diarrhea, right? So if
Other than an infection or a maybe intake of some foreign matter?
Right.
Yeah.
So if you have diarrhea, the best thing you can do is to make sure you rehydrate yourself. Now, generally, and the way you rehydrate yourself is probably the best thing, and I'm not a spokesman for the company, but some equivalent of Gatorade.
Some
A balanced salt,
electrolytes.
electrolytes, Pedialyte, Gatorade, any of those balanced salt solutions. And as a matter of fact, for cholera, that is exactly what's prescribed, because cholera is endemic to a lot of developing countries.
Yes.
And there is no mechanism for giving them IV transfusions, right? So what the World Health Organization does is it gives them salt packets. And these salt packets are basically, the concentration of salt in them is essentially what's the concentration of salt in your blood. And they have they have sugar in it as well. And they tell the families, you dissolve this, make sure you boil the water because hygiene is most important. You boil water and you dissolve it in that. But off late, WHO has been recommending that you're better off doing something like rice-based starches, because there you get more bang for your buck. Because you can introduce many more sugar molecules because they're all connected, and for the same benefit.
I see.
And I think the two things that have really controlled cholera is, and the infant mortality rate in the mid-60s of the last century was, we were losing 5 million children a year to cholera.
Goodness.
And now it's down to about, it's still high, but it's down to about 1 million.
But where is that? That's not here, is it? I mean,
No, it's endemic largely to places like Bangladesh. But there are recent epidemics. As you know, after the Haiti earthquake, there was a huge cholera outbreak, and that was a very unfortunate thing. It was actually brought in by one of the relief workers.
Is that
And
symptomatic of a bloated stomach when you see the little babies with?
Bloated stomach very often is symptomatic of what is it called, kwashiorkor, which is a protein malnourishment. And
Malabsorption?
No, it's malnourishment. They don't have enough protein.
Not enough.
And one of the signs of that, it's a disease called kwashiorkor, and they exhibit themselves as bloated stomach. But there could be a whole bunch of other diseases as well.
Yeah, liver backup, liver cirrhosis, things
Yeah.
like that.
Ascites,
Yeah.
right.
So a number of things cause that appearance.
Yeah, that's like the one and only time I ever tell people to drink pop is if they're having something, where they're vomiting or they have diarrhea or something, because the sugar, they need to rebalance the sugar and salt in their system.
I see.
So if you don't get any of these salt solutions, like you mentioned, the next best thing is to use, and preferably flat pop, because if you use carbonated pop, very often it can act as an emetic and you start throwing up. So if you use flat pop, you
Because of the
replace the
sugar? Okay.
because of the carbonation, but you need the salt in it too. So, you know, I had a friend that before her daughter's wedding got very, very sick from nerves and everything else and was having all of these problems and couldn't even stand up. And I ended up giving her that Jell-O and pop and
Yeah.
stuff like that to try and rebalance it. I only had an hour and a half before she had to be at the wedding for 600 people, and she couldn't even get out of bed. And I was shoving all this stuff down her, and she said, "I'm just little, don't do this, Karen." I said, "Look, I could cure anybody in 6 hours, but I only have an hour and a half for you."
Down it goes.
So you got to do this. And she was there until 3 in the morning dancing around, so it
That's
worked.
good.
Wow.
That's
Wow.
good.
It worked. It worked.
saltines and ginger ale.
So did you have some questions?
Now, that's interesting that you mentioned, Mina, ginger ale. A lot of people, when their stomachs are not very balanced, they go for ginger ale. Why is that? Why does it work?
I am not 100% sure, but so obviously I come from India, right? Ginger has incredible medicinal
Okay.
qualities.
Yes.
And I'm quite convinced that, ginger is very good for upset
Yes.
stomachs. Ginger is
Digestive
very good.
issues.
Yes.
Digestive issues.
Yes.
Ginger is also very good for sore throats. And so I'm sure there's something medicinal in the
Okay.
ginger that causes.
think
Would you
it has a
recommend like
calming
boiling it and consuming it maybe in tea?
Oh, they do
The raw-
suggest that in
the
a lot
raw
of places, yeah.
So
It
ginger?
has a very
Ginger.
calming effect on the system.
Because
I
now
think.
it's easily accessible. Almost every grocery store has ginger,
Right.
and it's highly recommended. So
Yeah, the other thing that, it's highly recommended, and ginger with hot water and lemon is very good, not only for the throat, but also for calming down the digestive system. Ginger chews are also very handy to carry around when you
for
have
nausea even.
For nausea,
right?
when you.
And
when
what
you
about
have-
fennel? In Indian restaurants, they always have fennel.
Yeah,
available.
that's more like a cleansing agent at the end of, it's sort of the equivalent of your Listamint.
I like the
At the end,
taste of it.
right?
It is cleansing. Italians use it too.
Right. But the other thing that you can also use for, especially for throat ailments, that we got as kids was always black pepper.
Oh, really?
Black pepper is very much more than red pepper. Black pepper has got lots of medicinal qualities in it. And so you boil black pepper with a little bit of ginger and hot water,
Okay.
and it's very good as a for your throat. So I believe in a lot in
Natural.
Natural
medicines,
things.
right?
Well, our show believes
Grandmother's
a lot
res-
in natural things.
Yeah, grandmother's medicines, right?
Yes.
What about acid reflux? Everybody's been asking me about that lately. My cure for that is Gaviscon, because most people, matter of fact, a friend of mine said to the other day, "How come doctors don't often tell you about Gaviscon?" I said, "I don't know, maybe they don't know about it, but it tastes better than some of the other things. It goes down better and it seems to work better." But what do you have to say about that as a GI specialist?
Well, acid reflux is basically because of two things. One is your esophageal sphincter is not as tight as it should be for whatever reason. And the other thing is you have a hyperactive acidic stomach. But really the bigger danger that acid reflux can have is sometimes you get regurgitation of bile, and the bile comes up and actually it affects the lining of around the esophagus. And it's fascinating that the cells that line the esophagus don't have the kind of natural protection that the cells lining the stomach do. The stomach cells, they don't get chewed up by acid.
They're tough.
They're very tough because there are mechanisms in those cells that prevent them from getting chewed up. But I think in terms of remedies for that, I know personally that I think, drinking caffeine late at night is not good for acid reflux. And I think it can be really controlled by dietary factors and dietary issues.
Well, you have to be careful that you don't give too much alkalization too.
Right.
But for years they never knew about H. pylori either.
Right.
And my husband happened to have that, and he always blamed it on, he was a police detective, and he blamed it on the belt and the heavy gun, or me giving him an ulcer, one of the two. And then the discovery of H. pylori came out, and all you needed was 2 weeks of antibiotics and some Pepto-Bismol, and I think there was a third thing, and gone forever. So, but a lot of people don't know that. They think that they're dealing with ulcers. I once got a low grade on a paper because I said to give an ulcer patient my case study, chocolate, he drank chocolate milk. And I was supposed to tell him not to do that because chocolate takes the calcium out with it. And so everybody should know that when you drink chocolate milk. Although they say you should drink chocolate milk after you exercise. I don't know why they say that. But.
There is a remedy that also seems to be effective, is a little bit of aloe vera in the morning on an empty stomach before the day, and maybe an ounce at night before you go to bed, so it can lie in there and help to heal and make benefit.
Because if you keep having that, you have to distinguish, too, between whether you can relieve the symptoms of that or if it's heart problems, because sometimes heart problems show up as things like that. People think they're having acid reflux when they're really having heart pain or something. So it has to be distinguished.
And the reverse can be true as well, that people who think they're having a
pain.
heart problem, it's nothing more than
digestive
and an acid
or
reflux.
gallbladder problems. That can also, present itself in the shoulder, in the back, in the jaw, like hearts do.
Right.
So, when the body works right, it's a miracle. Because there's like 900 million things that can go wrong at any given moment. So
And in today's society, in today's diet, why it's compounded.
And then a lot of people from drinking or other reasons get the esophageal varices where they have, close to the surface, and then there's bleeding and hemorrhaging, and people can die from that too.
And with the esophageal varices, very often, unless you are conscious of that whole phenomenon, you're right. It's a silent killer because you can bleed into the stomach. You don't realize what's happening. You lose a lot of blood. And the reason the varices happen is because if you have a cirrhotic liver, there's a backup in the liver, and the blood pools around the veins of the esophagus, and they're not strong enough to hold all that blood, so they start leaking, and they leak into the stomach, and then the person can.
So what about cirrhosis in people who aren't drinkers?
Well, that's hepatitis-based cirrhosis, and that's tragic.
It's people people get lung cancer and never smoke.
Right. Right. And yeah, I know somebody really well who actually battled, had a cirrhotic liver, had esophageal varices. He was actually a professor I trained with, remarkable man, and he fought it, and then eventually had a liver transplant and passed away.
Now they're saying they can take out parts of the liver and put in parts and do things like they could never do before because of the bleeding.
Right.
And now, why can they do it now when they couldn't do it before?
Well, I think because technology has improved so much and you're able
With
to.
lasers or something.
Right. I mean, the very fact that you can get your gallbladder out and never really have a big incision, they do it all through the belly button, right? They just cauterize
they
it.
do. And that used to be a major surgery. When I was in
Yes.
nursing school, people had major surgery and drains and 6 weeks of recuperation and everything, and now it's like in and out. All right, talk about gallstones.
Okay, so gallstones are common. It's again like an equilibrium. There is this, you must remember this from nursing school, right? So there is this triangle pyramid because you have cholesterol, you have phospholipids, and then you have bile acids. And you need the three of these basically to help digest your fat. And you also have calcium, right? And if that equilibrium goes out of sync, then you could just have a little nidus for precipitation, a little crystal of calcium, and then you can have gallstone formation on top of that, just because it's really a solubility problem, right? And then they can, and some people have a greater predilection for gallstones than others do, but you basically are putting these three things, instead of being in equilibrium, out of solution. And then they can accumulate in your gallbladder. They may remain incipient there for a long time. You may not know it. And
is there a natural cure for it? I mean, people drink vinegar. Does that work?
I don't know.
I don't know if it does either. That's like, kidney stones. I knew a woman that had 11 children and 1 kidney stone, and she said she'd rather have the labor of 11 children than 1 kidney stone because they hurt so bad, because it backs up the urine into your kidney, and that's what causes the pain. And I've seen men who've had that who I thought were having a baby because they really are in pain. We only have maybe 4 minutes or something left, so please go ahead and ask questions if you'd like.
And when you were talking about these different issues related to different organs, there's also emotional connections related to the organs. And we often use in our work, we usually recommend diet adjustments and nutritional support, but we tell them we can only help you so far, and if you don't correct the emotional connection to that particular area, then you will improve, but you may not get to where you'd like to be. Because when we're talking about liver and we're talking about thyroid, usually talking about strong negative emotion. And of course, many times when I present that to people, then some of them just burst into tears and then explain to me exactly what they went through. And then once they release that, in reflexology, there's a sensitivity or an inflammation in that organ. And when I touch the reflex on their foot related to that organ, it would be extremely tender. And once they release the emotional connection to that inflammation, I would hit that reflex and it would be less tender, just like that.
Well,
Which
stress
is
and
kind of
tension
Right.
during eating is terrible.
Yeah.
It's a terrible thing for digestion. It stops the digestion, doesn't
Yes.
Yeah, do you know about the gut brain? So the gut has as many neurons as the brain does. So we don't realize this, but you have your intestine and your stomach and everything else, but then you have muscle layers. Between the muscle and the what's called the lining or the epithelium, you have a huge neural network. They produce a large number of neurotransmitters. So serotonin, which is very often associated with depression, one of the major sites for serotonin production is the colon. And if you have increased serotonin production, you can have, like you know about nervous diarrhea. That's
Yes.
partly what causes nervous diarrhea.
Like colitis type?
Yeah, colitis, and then inflammatory bowel disease, the whole
Stress.
thing. Stress is you're absolutely
My
right.
first show
And-
was a gastroenterologist and a psychiatrist arguing about what caused colitis. But I told them they were going to argue. I don't expect people to argue, but I warned them. And
yeah. But the thing is that, you're absolutely right. So a lot of the stress hormones have direct effect because they're produced by some of the nerve terminals that line the GI tract. And we have as many, and now the other big thing is the gut microbiome. That has we're all carrying enough microbial organisms inside us. Actually, we have more microorganism cells than we have our own cells. And that whole crosstalk between them as well and the host is very, very important in terms of determining. They're
well, do you
linked to
believe
obesity.
in probiotics?
Um,
And the new thing, what's that, prebiotics now?
Right.
Probiotics, prebiotics?
Right. I do believe in probiotics to a certain extent, but very often you've asked the question, why is it that you think that if your microbiome is messed up, you can take a probiotic, then you should think that that should be it. It should be a one-shot pill, right? The reason it's not a one-shot pill is because you have such an intense ecosystem sitting in your gut that when you take a probiotic, it has to go in there and create for itself a new niche, and that does not happen easily. And that's why you have to keep taking probiotics. The other big thing right now is fecal transplant. You've heard about that?
Oh,
right?
yeah, fecal transplant,
Yeah.
that's right. Yeah, not too many people are lined up for that.
But
Although I hear it works.
Mayo Clinic has got a huge study going on that.
Really?
Yeah.
And the purpose of that is?
The purpose of that is because when you do antibiotics, excess antibiotics, and you basically, what happens is you take off all your good bacteria, then species like Clostridium difficile take hold, and they cause copious amounts of diarrhea and distress. And the only way you repopulate the patient's gut is with their some kind of an original normal fecal microflora. And it's the problem with probiotics, for example, is that they're only, you're counting a handful, 10, 20 of them, whereas inside you have millions of them. So
Okay, well, I know this
Sorry.
has been so
I'm
interesting.
so
but we're
sorry.
out of time. No, don't be sorry. We just
This
wish
is
you
very
could stay
good.
forever. But anyway,
Very
we're
good.
out of time. I'm sorry. So you can email me at AskTVNurse if you have any questions. Thank you for joining us, and thank you all
Thank
for joining
you.
us. We'll see you next time.